perspective is that the rare diseases can be included in the chart of the disease where the reimbursements are being given to employees. So one way is that outer cap of that reimbursement sometimes exceeds where the employees are not able to take the benefit of that. So for that, the staff welfare schemes are being taken care of. So in IFCLs, various staff welfare schemes has been made where the staff welfare fund is being pulled in those kind of schemes, and those staff welfare funds are again invested by the fund manager, and whenever any employee is in need of these kind of funds, this is allocated directly to that particular employee. So long term funding can be taken care of through the staff welfare schemes in the corporates like IIFCL. But whenever whenever the long term funding we are talking about, the amount and the pool is very huge. So we need to understand that how the amount and the pool can be managed. Because one, these are the rare disease. Second, these are very not affordable disease for a middle class family. Even for a higher class family, these are not very affordable disease. And third, we as India are in dire needs of funds because we generally remain short of funds over these kind of disease. So to address all the three issues, we have also suggested that the CSR funding can be utilized even to raise the funds from the market. When I'm saying this, everyone can be encouraged to subscribe to a bond where the investment manager is using those bonds to use the funds for the treatment of these kind of disease, and a general public may contribute not in the time of donation but at the type of funding those particular families, and the amount can be very small. So for example, if I come down to a particular person saying that I need 10,000 rupees for a particular treatment of the disease, I may not be very comfortable giving those funds. But if a particular person come to me that you need to invest only 100 rupees in a bond and this funding goes to the CSR funding of the AIIMS to treatment of these kind of diseases, I may be comfortable because 100 rupees is a very small amount for me to spend. But the outreach of these kind of fund has to be in the general public. So it has the massive, huge, tapping of the funding is required, one, and then the awareness of the general public is also very important.
Thank you, Madam Sonal. Welcome, Dr. Alexandro. Thank you so much. Welcome. Good morning. It's very early hours for you. We have already started the discussion. There were some technical issues. We welcome you. So we have started. We have our senior financial advisor from AIIMS, Mr. Neeraj Kumar, who has made some opening statement. Then we had Ms. Sonal, who's from IFCL. She was talking about the employee scheme from their perspective. Then we'll just go to the next question on talking about CSR. Then we'll ask you about what is the scenario in the internationally in different countries from the employee scheme. Meanwhile, I would also like to welcome Mr. Satish Kumar, father of Shrishti, who has been able to get 16 crore funded from Coal India and for Zolgensma, and Mr. Vikas Dwivedi, father of Navi, who is also getting a treatment for SMA. Thank you so much as parents for joining, and we can move forward to the next slide, please. What is corporate social responsibility, and how can CSR help in meeting the financial need of families requiring support for treatment of rare diseases? And we have spoken at the beginning, Dr. Anup, that the amount is 16 crore for one time, ranging from that to 4.2 crore per year to 1.4 crore per year to 6 to 8 crores per year, lifelong therapies. So whether CSR can have anything to say.
Good morning, and thank you for inviting me. If you see CSR from a common man's perspective, CSR is nothing. CSR is just the social responsibility of any business house to conduct business into an ethical manner so that people are ensured good thing in life, number one. And we are also ensuring the good health of our planet. Once we talk about good health of our planet, that means we are doing everything to preserve our planet, its environment. This is simply ethical responsibility of a business house to conduct business into a socially responsible behavior. Now, as per se, we are knowing that India is one of the countries which made CSR mandatory under Section 135 of the Companies Act 2013, where any business house which is having a certain limit of profit is supposed to invest 2% of its profit into the corporate social responsibility activities. Now, government has defined a lot of sections whereby we can put this CSR funding for use. Another section is the taking care of the patients, taking care of their treatments. And once we talk about treatment also, that means treatment can be for any disorder, a small disorder to big disorder. Per se, they are not defining the rare diseases, but any disease can be covered. We understand the rare diseases may be costing the medicine which are amounting more than crores, something like for a patient, like for DMD, like for this other syndromes of gastrointestinal disorders also. But CSR is one of the mechanisms which can give the fund at least for that financial year. The only issue which is here with the CSR is for a rolling year of one financial year, that thereby companies funding the any project through CSR for that financial year. As Madam, I think, told rightly from IFCL, maybe sometime we have a mechanism whereby we can have a common pooling of funds which can work year after year, so that we are not having a rider whereby we are limited for funds only for 1 year. Because disease is not going to stay only for 1 year. It is going to stay beyond 1 year. Thank you.
Thank you, Dr. Anup, for sharing your thoughts. Can we move to the third question, please?
So I would like to add here.
Yes, sir. Please, sir. Please, Mr. Neeraj.
India has, may of course, joined late on the CSR thing, but finally, in last 10 years of its, working, we have come up. Presently, there is a movement of mobilization of something around 25,000 crore rupees in a year, last year, and out of which 30% has come to the health. But rare being rare, the disease itself, the research and the creation of the systems and the treatment, I have no idea how much it has really come to the rare disease side. So, we will have to actually drill down the policy and make the resources available to the last level of expectation. And this is one of the areas where we actually expect the money to come, and research is also, done in a more advanced manner, so that the cost is also brought down. We cannot say after 5 years also that this is a 16 crore rupees worth, drug. So by that time, in next 5 years, we should expect that the cost of drug also comes down very drastically, so as to make it may not be affordable by all, but that has to bring within the reach of the Indian populace.
Sir, I would like to add one more thing. You see, in CSR, we are taking money from one business house. And this money we are spending for the cost of medicine, which is benefiting other business house indirectly. The person who is the company which is selling medicine for high cost, let's say 1 crore, 16 crore rupees, the company is benefiting. As sir said rightly, maybe in future we got a mechanism. Most of these medicines are imported in India from other countries. Maybe we are having a mechanism whereby we can reduce the cost of this medicine drastically. Because in our experience, what we could see, a corporate house says, out of 10 crore rupees, I can fund the healthcare of thousands of patients. Versus out of 10 crore rupees, I can fund the healthcare of only 1 or 2 patients for rare disorders. So should I look for larger masses or should I look for limited masses? So that's a key question for a country like ours. Thank you.
Thank you. Dr. Alessandro, what is the situation globally? Like that day on that global, scenario platform, we heard from my colleague from the UK that NHS funds everything. And here we have heard that day from India that up to 50 lakh is given per individual patient in the rare disease, plus a portal in which they are put for, crowdfunding, but which has not been that successful. So it is, there were the two extremes which we had. Plus we also had in Sri Lanka, which they had nothing. Even like us. So, your...
Yes, thank you, Professor Shefali. Yeah, I indeed, I think first, a few points. I believe in many countries where also this is not just the treatments and the drugs, but also the ancillary care is provided, because that also generates costs, right? There are nationwide rare disease policies. And therefore, in countries where there is a national healthcare system, I think this is, in many places, less of a problem. And in fact, treatments for neuromuscular diseases are available, they are funded, maybe not for every patient or every different case. There are some eligibility criteria in some countries, but this is totally available as well as the ancillary care. And these are discussions that are done mainly at a national level, right? Of course, in some countries there are maybe a ceiling, like what's called plankija, where the patient has to have some co-payments, but it's not a relative to the treatment. It's a total amount per year, and is I would say is quite manageable by the families. I think the countries, there are not that many examples I'm aware of countries that have employees benefits for rare diseases. I think this is an unusual situation, and I personally am not aware. But because also I believe that these are discussions that have to happen at a national level with the governments of the Ministry of Health. Of course, in countries like India, we need also to think about, and not just from the industry has to think about sustainable reimbursement schemes, or talk with stakeholders on how we can make sustainable the access for the care of neuromuscular disorders. So indeed, this is a challenging situation, but I think we all in our industry, all the people in the industry is willing to tackle that and to think and collaborate.
Thank you, Mr. Alexandro. Thanks for sharing your opinion. Can we move to the next slide, please? Our next question is, are there any ethical issues that need to be taken care of while getting funding from the employee beneficiary schemes and CSR? What are the laws that govern these schemes?
So,
yeah, Neeraj sir, we'll start with you, sir.
Yeah, basically, in India, if we talk specifically of India, there is no ethical issue actually. We are here to take care of each other and share the resources, even if they are, meager. So technically speaking, I should say that ethically, everybody is on the same platform. But, question of applying the same, when it comes, it is a very difficult. So if I have I have some money, I have a fund, and there are 4 or 5, beneficiaries, they are expecting the benefit out of it. So whom should I give? So there first comes the question of, identifying the appropriate, who would be best suited for the treatment available, because we all know that treatment presently available, drugs available as of now, everything has limitation. They are not wonder drugs. They are the drugs which may not, yield the result expected. So everything is on experimental basis. So, those kinds of questions, they need to be thought of by the experts in those fields, and the most appropriate, subject should get the first benefit. And of course, all others should also get. So, as I earlier also said that this is beyond the affordability by one and all. Even the big corporates, they sometimes shy away. So not only the CSR, not only the crowdfunding, not only the government, the insurance companies, most of the sectors in private companies, they have the insurance facility, health insurance facility for their employees. And while identifying those occurrence to the individuals, family members with rare diseases, it also takes time. And then when the question of inclusion of those, subject and the disease comes, the insurance companies are very, very, calculative while, issuing the benefits or covering those patients. So we have to actually, come together again, and we have to come together continuously to, whenever the question is posed to us, we have to handle it. We have to, answer it and bring everything in a framework. There should not be many options or the, gaps left in those kinds of schemes. So unless there is a full proofing and in next few years, we will still be left with short of funds, and funds would be there if they would be there, but they would not be reaching to the actual patients. So those kinds of, mapping and registry making and, that proofing has to be done.
Thank you, Neeraj sir, for sharing your views. Mr. Alexandro, we had definitely discussed many of these in your prior sessions. Would you like to add to this?
I mean, for me on this is actually a bit hard to comment, Professor Shefali. I'm not an expert of the situation in India, so indeed it's a complex topic. So I'm not sure I can really add on that one.
Yeah, it's only Alexandro can tell us only about the world. He is new to India. He's going to come to know about India.
I'm new to India, so I'm learning much more than actually contributing, especially on the topic today. So.
Can I add something here, please?
Please, Bhaivan. I'm sorry. I had to move out to take some urgent call. I'm so
no
sorry.
worries, no worries.
Yeah.
I'll just like to add here that from the employee perspective, instead of taking an individual health insurance, we take a group health insurance. So in the group health insurance, we can always have a room for negotiation where the reimbursements are being given to the employees. It may not, judged by the health companies whether the particular case is eligible for the reimbursement or not, but it has to be judged by the company, because the empathy towards the employee of a company and the empathy towards the medical insurance for an unknown person would be different. So the company may, take a decision whether the particular employee fit for the particular type of funding of this treatment of rare disease or not, and then accordingly the treatment and the funding may be given. So decision might rest with the company of the employee rather than giving the decision making power to the health insurance companies, because for them it is a day in day out. So they will not be able to decide in a particular way where it is required, but the company themselves can take a decision in an effective manner. And every company do have a team of the panelists over there and the team of the committee where they take the decision of these cases.
But there is a very big issue. Next slide, Dikhana. The amount is huge, the amount is huge. So how much, to what extent can these schemes help, because of we have our country is very big. We have, we are in the low middle income category from the internationally, if you see. So, I mean, there's so many things, from nutrition, poverty. I mean, there's so many things to be tackled. So how much, are we able to, deal? And it is, you have to see this perspective, plus we have to see the parents' perspective when the treatment is available, what dilemma they undergo. We will discuss this, and then I will ask Mr. Satish Kumar, who was able to get the first public sector funding from employees, and he was able to get the 16 crore Zolgensma from Coal India Limited. So after that, I'll say, so I mean, to what extent are we, do you think we can handle, because the numbers, as I mentioned to you, having periodically, I'm sorry, Alexandra, I'm talking in crores, so that becomes how many million dollars or something? 16 crore is 2.125 million. Yeah, because it's your MRP, right? Right. So I mean that roughly, sorry, I have a habit of talking that. So, but I think you have been overtaken by this Zolgensma has been overtaken by another gene therapy, which is more expensive than, right? Right, recently?
So yeah, I mean, I'm not sure it's still like official. There were some press releases from another company, indeed. But I mean, also on the price, right? So maybe I can comment. It is the price that being communicated. It is also based on prices that we look at benchmarks of other treatments, and especially in the US and in Europe. But when we move to other countries, of course, we've been discussing with the governments, with the payers, the decision makers, to find a sustainable solution. For example, installment schemes, so that we can divide the cost over the years, and we've been doing that. As I mentioned, the product is available in many countries, even in countries like Egypt, where it's covered by the national government for SMA patients. It's broadly available in many places, also in the Middle East. The aim is, as I was mentioned, is to make it sustainable, and we were happy to find different solutions based also on the possibilities of the country, and we are indeed quite actively looking at solutions for lead to low income countries. Again, as I mentioned, we begin working very hard to address that. So the numbers that you see in the press releases, yes, indeed, that's a price that reflects the value of the product. But all these numbers is also press releases, or the number, I think, the US of this new gene therapy that you talk about is a product that was going to be launched in the US in pretty soon.
How much, Dr. Anup, you think, to what extent we can cover the medical expenses?
It depends on the company to company, how much they want to fund. If you see the experience of this hospital, AIIMS hospital, big corporates have always come forward to help the patient for their diseases. But the only question with them is that how much we can fund, and beyond 1 year, what will happen to patient also. So that is a big dilemma with them. That's why they want to prefer to give a package to AIIMS, whereby they say, okay, I will give it rupees 10 lakh. That means something like, you can say in US parlance, $1,500 or $15,000 package for some disease, whereby you take a package, you treat the patient, whether it takes 1 year or 2 years. Okay. Now for rare disease, they say the treatment may require long-term funding beyond 1 year. And I know out of this amount which I give only for one patient, I can treat more number of patients also. So here comes the question whether we can take package for rare diseases. As we discussed initially now, the biggest question comes here, the costs of the medicine, which are exorbitant in the case of rare diseases. So maybe in future, once the cost of these medicines are brought down to lower levels also, we can pursue company, you give the packages at least not for 1 year, at least for few more years. That means by that time, or let's say 1 to 3 years, we get a package. After 3 years, we develop a policy for not only for India, for other countries in the world also, whereby we got some sort of pooling of fund outside, and Madam from IFCL told rightly, whereby we can recoup this fund from the CSR donor sides.
I would like to add here, because we are talking about the money, which is real for the rare disease. Breakthrough is really required, and it is required now, as early as possible, because as we talk in present, it is grossly insufficient. And a question before, we were talking of the ethics. Suppose I pose a question to any big corporate or to anyone who are ready and supporting their employees. Say there is a patient in their employee's family as of now. So they are able to come up with the support. Suppose, and it's a big corporate, suppose there are lakh people or more, or something around that. So there are cases 2 or 3 or 4 in next few years. Would not they modify their policy, or they will start thinking to channelize more resources? So we have to discuss this thing in and out very thoroughly and try to cover next few years possible, so that whenever there is a breakthrough and the costs are coming down, then those kinds of questions become insignificant, and we are able to take care of our employees, their families. And actually, I am of the opinion that the framework should be such that individuals also taking the medical health policy. That kind of support should be available to the individual families if they are not part of the employees' health scheme. So that kind of framework, that kind of support system should be there.
Thank you. And if a patient comes with, what is AIIMS providing? I mean, in principle, any capping is there, or what? I mean, or individually it will be decided as per case basis?
Ma'am, actually, in India, fortunately, the government has many schemes. But technically speaking, the amount we are talking of is grossly insufficient to cover such kind of, diseases even for a patient. So the case to case basis and based on the merits identification and classification of the disease and the patient, he can approach the central government, the state governments, the CSR, funding agencies. So for open citizen, those kinds of options are available, but technically they are grossly insufficient, and it will not be able to address even for a single use of those drugs. So we have to work around.
Thank you so much. I will request our our own Mr. Yadav, who is handling all this funding in the department. So if a patient comes, what are the various schemes which are available? To Mr. Dhaneshwar Yadav, MSSO, who's been here for nearly 2 decades with us in pediatrics. So he's been providing a lot of support through the various, whatever the things are available, so various schemes. But again, to what extent is the big question. So we'll just go through the schemes. Yeah, Mr. Yadav, आप बताएंगे please क्या schemes है, और इसके बाद सृष्टि के पापा जी, Mr. Satish, how was your journey? आपको कैसे है? You are a path-breaking person, so I think we'll have to understand. So after ये क्या है? What is नहीं? Please, this is next session. हाँ, please शुरू करिए, बोलना स्लाइड आ जाए.
नमस्कार, मैं धनेश्वर यादव हूँ और पीडियाट्रिक्स डिपार्टमेंट में एज ए सोशल वर्कर के हैसियत से काम करता हूँ. नॉर्मली जो पेशेंट्स हमारे पास पुअर पेशेंट्स आते हैं और क्राउड फंडिंग के टर्म्स में जो फाइनेंशियल असिस्टेंस फॉर द ट्रीटमेंट ऑफ पुअर पेशेंट मैं कैसे मोबिलाइज करता हूँ, किन किन सोर्सेज से करता हूँ, वो मैं कवर करने का कोशिश करता हूँ. There are two kinds of sources. One is governmental sources and another is non-governmental.
Next slide, please.
The government sources, we have the umbrella scheme of Rashtriya Arogya Nidhi, and umbrella scheme of Rashtriya Arogya Nidhi covers the 3 parts. One is the Rashtriya Arogya Nidhi, second is the Health Minister discretionary grants, and the third is the financial assistance for poor patients having the rare disease. And another government sources is Prime Minister National Relief Fund, and then the Chief Minister Relief Fund, and non-governmental sources. Already other esteemed panelists have talked about the CSR, and we have the NGO, then we do have the private donors.
Next slide.
Financial assistance under the umbrella scheme, there are 3 components. First is the Rashtriya Arogya Nidhi, normal diagnosis, normal diseases, where the poor patients want to get the financial assistance. We mobilize the resources from the Rashtriya Arogya Nidhi. The upper limit is the 15 lakhs. Any poor patient who wants to avail the fund, the 15 lakhs rupees is given through the Rashtriya Arogya Nidhi. This is the Health Ministry fund. And the second part is the HMDG, the Health Minister discretionary grant. Here the amount is 1.25 lakhs rupees. Under the Rashtriya Arogya Nidhi, currently only those categories of patients who are having the Antodaya Anna Yojana ration card. There are 2 kinds of BPL card. One is the BPL card, and the poorest among the poor in BPL card is called the Antodaya ration card holder. So under the new scheme of Rashtriya Arogya Nidhi, only the Antodaya ration card holder people can avail the 15 lakhs rupees under any chronic illness. And for the rare disease, now the amount has enhanced up to the 50 lakhs. Earlier it was 20 lakhs. So under the Rashtriya Arogya Nidhi scheme, any patient who is having the rare disease, they can avail the fund up to the 50 lakhs.
Next slide.
Objective of RAN scheme to assistance to the poor patients living below the poverty line, suffering from the life-threatening disease. For their treatment are the government hospital having the super speciality facility. Both schemes are implemented through the National Health Authority of India and its IT platform, launched on May 2021. The same thing which I have spoken, there are under the Rashtriya Arogya Nidhi, the patient can avail the 15 lakhs rupees for the treatment under the Health Minister discretionary grant up to 1.2 lakhs rupees they can avail. Under the Rashtriya Arogya Nidhi, only the BPL categories of patient who is having the Antyodaya Ration card can be applicant of availing the 15 lakhs rupees. But under the Health Minister discretionary grant, any patient who is having the priority household ration card, they can avail the benefit of 1.25 lakhs.
Next, please.
Under the rare disease, now not only the BPL categories of patients, non-BPL categories of patients, 40% population have covered. They can also apply to the Rashtriya Arogya Nidhi and they can avail the amount 50 lakh rupees for the rare disease. Delhi Arogya Nidhi, there is another source of Delhi government. Any person who is a resident of Delhi, they can apply for getting the treatment. Under this scheme, they can avail the 5 lakhs rupees, and the income certificate of the Delhi resident has to be up to 3 lakhs rupees, and the photocopy of ration card as a document is to be attached for applying to the Delhi Arogya Nidhi, and the estimate certificate should be given by the treating doctor. Under the Prime Minister Relief Fund, the patient is required to have the estimate certificate, and through the recommendation of MP, the patient whoever belongs to that constituency, they can apply to the Prime Minister Relief Fund. And this is the partial help. Only the 50% grant is given. Means any person who apply to the Prime Minister Relief Fund, if the amount is sanction of rupees 1 lakh rupees, in order to avail the 1 lakh rupees, they have to add the one more lakh rupees for getting the total fund of 1 lakh rupees. Means under the Prime Minister scheme, the 50% grant is given. Only the cancer patient is having the 100% grant. These are the documents: two passport size of photograph, income certificate, and Aadhaar card have to be attached for getting the fund from the Prime Minister Relief Fund. Under the Chief Minister Relief Fund, up to 2-3 lakhs rupees is given for the poor patient. This is the 100% grant, and the recommendation of MLA is mandatory, and the estimate certificate has to be given by the treating faculty or treating doctor. Under the CSR, the Dr. Daga has already covered. So the same thing under the for the rare disease, we can mobilize the resources from the CSR depending on the requirement. Thank you.
Thank you, Mr. Yadav. Dr. Alessandro, you remember we were discussing on that global scenario discussions whether can you stop sharing this thing? Yeah, can we whether we can have NGOs being funded by philanthropists and other MNCs for CSR, because we were discussing that even in the Humanitarian Access Program Day that they are not sustainable. Humanitarian Access Program, our patients are getting from Novartis, Roche, and Biogen through direct relief NGO. But for how long? Because that's not sustainable in the long run. We have to have and other thing. If you that day, Adrian from PTC was telling from Ireland that they've not made any profit, and still it was so difficult for them to continue, and they have been patient-centric, supporting to the parents, and they are being able to provide humanitarian access. Even our 11 patients who are on that trial, after completion of trial are there. But point is, we understand the amount of research and the time and the money which goes into the making drug development and how it was discussed in various sessions. So, whether it's plausible that we can have, and how do you think we can look at it globally, because I don't think I think all parents, let me tell you, in our country, many times the parents who come to us, they've already researched. It's not only for DMD SMA, they know which trial is going on in which country for the drug. They have already done it. So they want everything. So even in an LMSA like ours, because of the more awareness, not only DMD SMA, they know even for DMD, they will know what are these trials are going on. They've gone through the CTRI. So, and they're desperate to have their child enrolled. Here, the drugs are FDA approved, So you can understand the dilemma. So can some movement be created at a global level in which, we have, some CSR and some philanthropists, they can do, if you see the amount of expenditure on certain things which are not, which I will not like to list, there's some globally a lot of expenditures being done, which are, which can be avoided, and it can be given for healthcare. So, I mean, if that case, can you see something?
Yeah, I mean, it's quite an interesting question, and I think it is really about a policy. Well, of course, I'm not an expert on policies overall, but I would say on global level, I think that the challenge will be, it has to be recognized by organizations and national organizations that is actually a global challenge, right? And that was my point at the beginning. I think, especially for rare diseases, national policies for rare diseases are required, and then and that has to start from there, which means also making it easier to have also compassionate use programs, to have accelerated access, or to have accelerated regulatory processes, easier regulatory processes, all with the intent to make these treatments available to everyone. And I think for neuromuscular disorders, it's not just about, of course, the treatments, the medicines. It's about it's a lot about ancillary care as well. And so I mentioned in different different webinar, even with gene therapy, being able to have access to proper nutrition, to have access to proper physiotherapy, pulmonary care, the patients that are, let's say, type 2s and 3s, good orthopedics care, for example. These also generate costs, and these are equally important as the treatment itself. And then, again, when we talk about global actions, what we could do, I think also, even in rare diseases, as I mentioned also in different webinars, and thinking about even SMA, prevention and early diagnostics is even more important, because with early diagnosis, you can really reduce the cost at the long term, because with the new treatments, you can get the best possible outcome, which means reducing pulmonary care, nutrition care, physiotherapy, etc., all the complications. So I think it's not, it is a really holistic approach, a holistic discussion that we need to have. And I will not just be focusing only on the medicine element. And in fact, that what is happening today in many parts of the world, we see an acceleration of newborn screening for SMA, because I think we are all recognizing that if a patient with SMA is diagnosed very early or even pre-symptomatic through newborn screening, the chances for these kids to achieve normal development milestones are very, very high. And therefore, all the costs involved and the need and the burden on the families will not be there. And this actually, that's my hope, right, for the future, that looking into the future, even these rare diseases will be treatable very, very early on. And then there will be clearly a reduce of the burden, the economic burden, but also societal burden for the families. I think what is important we could do as a first step, globally, clearly, I believe, I cannot speak for each single rare disease, but then now really early diagnosis is actually an awareness that is very, very important. I think this can really impact the way and the costs in many places of this world.
Yeah, I would like to add here that, the mobilization of funds, whatever be the resources, we have to put in some part of it into research actually. And, patent, this is my point of view, that patent actually prohibits the further development by people having more ideas. So that kind of, patent sharing with certain government entities and research organizations, that can be actually beneficial to the world at large. That would actually, bring the development and further cost cutting early. Keeping it in an isolated place would actually delay the actual benefits. So technically speaking, we should put more money into the research and also sharing of research ideas, so that the breakthroughs which are less costlier than the existing or previous ones, we can get those. And Mr. Yadav has already shared what India is doing, actually the governmental framework. Technically speaking, I am not sure whether the benefit by an individual can be availed by applying in all those schemes. So if you have availed it benefit here, you will not be able to apply for others. So again, the this is as of now grossly insufficient.
Madam Sonal, you want to add something? Your opinion, any personal experience or something?
Ma'am, I would like to, take you on the numbers here. See, we as a country have an income from two major sources. One is from the export and import. That is not very good because we are a net importing country, right? And another is from the taxpayers. I hope we know that there are only 3% people in India who pay actually tax. So the numbers which I'll count about is around 4.5 crores who are actually, paying the tax in India. So the government funding is restricted to these kind of funding only. So their funding, if we expect that, they will be paying for all the schemes and all the disease, so they don't have funds from where they would pay. Someone will have to come down and pay, If we ask the government from where government would pay, the government also need to have funds to pay. So that's why initially also I, mentioned in my statement that the better way of, getting the funding, because we are talking about the long-term funding, we are talking about the sustainable funding, and we are talking about a huge amount of funding. So the better way of making these funding is to pool the funds. If we pool the funds, we pool the funds for 15 years, we pool the funds for 25 years. The fund is being managed by the investment managers, and those funds, even if the small contribution come from the corporates through their CSR channel, even if 30% funds come from the corporate through their CSR channel, those 30% can be pulled into the huge amount, and that pooling funds can be utilized by the big hospitals, big institutes, to take the charge of curing these kind of disease. The individual cases which has to be approved, that is a different question, because I'm not expert there, so that you will have to take. But where the funding is required, the funding can be channelized through the making the funds of the funds. So the funding, the pool can be come down there, and then they can channelize the funding for all the hospitals, or for all the uniform kind of disease, or a category of the disease, or a pool of the disease.
Thank you, Madam Sonal. Mr. Satish. Mr. Satish.
Yes, ma'am.
Mr. Satish, आपके बारे में आपका क्या experience रहा है, your struggle? अभी we are coming to the end of the session, तो इसलिए I wanted to be, I will ask your comments, and Mr. Vikas, I will ask your comments in the next session. And or if you, it's financial, if you want to say, you can talk after the Mr. Satish. Then I will go to all the panelists, one for final comment. Thanks, Dr. Gagan, for joining for the next session. We are running 5 minutes late actually. Mr. Satish, अपना experience बताइए, because आप first हैं जो इंडिया में you have been able to get Zolgensma funded by Coal India Limited. Please let us know.
Yes.
And as I'm aware that they had agreed for a funding for another patient, but after your child had got the medication, but unfortunately that patient died. So we would have had 2 people from Coal India.
Yes, ma'am.
Yeah. So आप बताइए, हाँ जी, तो मतलब वो लोगों के आपके problem के लिए they had sensitivity, understanding, and they were able to mobilize this huge amount, which I have also not seen in the last 34 years of my being at AIIMS and in clinical practice. Yeah, please, Satish ji.
हाँ, गुड मॉर्निंग टू ऑल मैम. ये हाँ, जैसे पता चला हमें कि सृष्टि को ये प्रॉब्लम है, तो और इसके लिए इतना अमाउंट लगेगा 16 करोड़ के अराउंड. तो हमने पहले यहाँ अपने ये कोल इंडिया का सब्सिडरी है हमारा, साउथ ईस्टर्न कोलफील्ड लिमिटेड, यहाँ पे बात किया, यहाँ पे जो चीफ मेडिकल ऑफिसर है उनसे. तो उन्होंने हमें बोला कि नहीं, यहाँ से तो नहीं कुछ हो पाएगा, आप सीधे जो हेड ऑफिस है हमारा कोलकाता, वहाँ जाइए, वहाँ पे बात कीजिए. तो वहाँ पे गए तो फिर उन लोगों ने बोला कि ये मेडिकल पॉलिसी में हमारा है कि जो इंडिया में ट्रीटमेंट अवेलेबल है वही हम प्रोवाइड कर सकते हैं अपने एम्प्लॉय को, बाकी का ये इंडिया में अवेलेबल नहीं है. तो बाहर के लिए हम लोग मतलब कर सकते हैं, डिसीजन लेना पड़ेगा, जो चेयरपर्सन है हमारे कंपनी के वो, और फिर बोर्ड ऑफ डायरेक्टर में होगा डिसीजन. तो वो लोग अगर करेंगे सब लोग मिल करके तो हो पाएगा. तो लगभग सितंबर में हमें प्रिस्क्रिप्शन मिला था एम्स दिल्ली से मैडम के थ्रू. फिर हमने वहाँ अप्लाई किया कोल इंडिया में, तो उन्होंने 2 महीने का समय लिया. उसके बाद बोर्ड ऑफ डायरेक्टर का जब मीटिंग हुआ, उसके बाद उन्होंने मतलब फिर स्पॉन्सर्ड किया पूरा अमाउंट.
Lottery for the Novartis Global Access, but he could not get. So
GMAP के लिए अप्लाई किया था, बट नहीं हुआ था इसमें.
Yeah. But उसमें भी ये है, one is clear, बार-बार बताया कि it's all blinded. So nobody knows which the patient is. I mean, they don't know anything about the details कि आपका बच्चा है, लड़का है, लड़की है, कोई नहीं है. It's all blinded. So it is, मतलब वो, it's a matter of luck. I mean, so it is totally blinded. So I mean, it says उनकी criteria है, we have to write blood test and all. If it fits the criteria, then it is blinded. But first is you have to fit, the tests are done, na? कई बार test में
yes.
That is there. So, but anyway, that was sensitive of their side, and you're lucky. And Mr. Vikas, you are Navi's father. आप कुछ बोलना चाहेंगे?
Yes, ma'am. Good morning, all of you.
Good morning.
मैम अभी तक का जो जनरली यस मैम, आवाज आ रही है?
हाँ जी, क्लियरली आ रही है, बोलिए.
मैम अभी तक जो जनरली रही है मेडिसिन की, वो दैट इज गुड, काफी अच्छा रहा, और उस बच्ची में काफी अच्छा, उस मेडिसिन से काफी अच्छा बच्ची में ग्रोथ हुआ है, और काफी अच्छी स्ट्रेंथ आई है बॉडी में, जैसा आना चाहिए था. और रेगुलर मेडिसिन भी चल रही है, और प्रॉपर तरीके से उसकी थेरेपी भी चल रही है रेगुलर. तो मुझे आई होप काफी अच्छा आप लोगों की तरफ से सपोर्ट रहा. देन कंटिन्यू अगर चलता रहा तो काफी अच्छा मेडिसिन के द्वारा उससे काफी अच्छा ग्रोथ है, और डेवलपमेंट भी काफी अच्छा एक्सपीरियंस है, जो बच्ची का अपने आप ऑटोमेटिक हर एक चीज डेवलप करती है, मतलब चलने की कोशिश करती है, बैठे बैठे चलने लगती है. हर एक बॉडी का जो मूवमेंट होता है, हर एक बॉडी का पूरा मूवमेंट है बच्ची में. यानी जो बच्चा 6 मंथ में अपना काम करने लगता है, वो बच्ची में पूरी ऑल एक्टिविटीज है आज के डेट में उस मेडिसिन के द्वारा. तो थैंक्स फॉर सपोर्ट आप लोगों का, जो कि काफी अच्छा सपोर्ट रहा, और उसके द्वारा हम वहां तक पहुंचे, और आज आप लोगों के द्वारा आज वो मेडिसिन हम लोगों को मिल रही है प्रॉपर तरीके से, और प्रॉपर तरीके से बच्ची को दे भी रहे हैं. तो उसके लिए थैंक्स.
He's from Risdiplam Humanitarian Access actually. So thank you so much.
Risdiplam मैम.
या वही बोले, Risdiplam, वही तो, from Humanitarian Access. पर यही है दुविधा, यही है कि कब तक रहेगा प्रोग्राम का एक्सेस, बिकॉज वो भी वो भी लाइफ लॉन्ग देंगे कि नहीं पता नहीं, दैट्स द इशू. सो दैट अगेन रिमेन्स. तो हमें देखना है सस्टेनेबल फाइनेंशियल क्या है. बट विकास जी, आपका मुझे एक बात बहुत अच्छा लगा. आई अप्रिशिएट कि यू आर अप्रिशिएटिंग बच्चे में जो विकास हो रहा है, द मोटर माइलस्टोन्स बढ़ रहे हैं. बिकॉज दे आर सम ऑफ माई पेरेंट्स, बार बार मैं बता रही हूँ, देयर इज नथिंग मैजिकल. लोग समझते हैं कि अभी जोलजेस्मा लगेगा को तो कुछ either after Zolgesma there'll be miraculous recovery and all, so that is why some of our Zolgesma patients have been dissatisfied. We have been happy with their mind. The parental expectation was that they'll be walking, running. And मैंने पिछले में हमने एक पेशेंट हर कैटेगरी का Zolgesma, Spinraza और Risdiplam के दिखाए थे. So parents have to understand, and बाकी therapies भी साथ में चल रही है. तो अभी भी there is a dilemma, दुविधा, that how will the sustainability of all these things go. So basically comes to financial sustainability options, which we have to look. Thank you, Vikas ji. And coming to the end of the panel, I will request my panelists to give one message, a brief message. So I will start with, and meanwhile, a poll, Dr. Kakuli is putting the poll on. I think I will request Dr. Alessandro, who has been so kind enough to have joined from Switzerland and multiple occasions, early morning for you. Thank you so much for your support, your comments, and then Mr. Sharma, then Madam Sonal and Dr. Anup Daga, and then Mr. Yadav. Yeah. Dr. Alexandro, your final comment.
Sorry, I thought that was the second one. Apologies. Yeah, I mean, what I can say from our end, from Novartis, also for gene therapies and access. Again, we are working hard on these topics, and we are acutely aware of the challenges that not only in India but in other places of the world around having access to these drugs. And we are looking at all these affordability barriers. We are looking at these economic realities. We've been looking creatively, and we talk about being creative on how we can address these challenges. It's also a journey for us as well, because on gene therapies, this is the first gene therapy where you don't have a chronic treatment. So even healthcare systems are not ready. Even in Europe, we had many debates and discussions on how one time off gene therapies could be covered. And what could be the financial schemes. So I think there is a lot that needs to be discussed, a lot about being creative as well. So I agree with all the panelists about creativity. And of course, as I mentioned in previous webinars, also in my team, we have a lot of people thinking about how we could do it. What are the options that we have? And we're always open for ideas.
Thank you. Thank you, Dr. Alexandro. All these webinars, all the 20 of them have been live streaming of YouTube, and we will all collate them to put it in one QR code and put it on our website and on the Global Genes website. Thank you very much, Alexandro, for all the support. We'll need your support in many more times to come. And Mr. Sharma.
Yeah, we are having a journey actually. So my hope and my expectations are that all the patients, all the babies suffering from rare diseases, they also travel through this journey with us, and we are able to safely bring them to have a meaningful life. At least they can mobilize their limbs and things. So that is the hope we are having, and for that ideas along with the funds. So I'm sure funds would be there spread across. So the ideas would, mobilize them, put them in a, like Ms. Sonal has said, funds of funds. So that kind of, idea we should work upon. And thank you, ma'am.
Thank you, sir. Madam Sonal.
Ma'am, just to conclude, I would like to say that the awareness, if we can create about the amount of the funds and the sustainability of the funds required for the rare disease among the corporates, among the general public, would help a lot. Because even if we expect that all the corporates come down and pool in their funds for these kind of rare disease, at least an awareness session can be conducted for the corporate, especially for this purpose. That will be helping them also to take their decision when they are allocating their CSR funding. So that is one. And second thing, for if we want to involve the general public in these kind of funding, again, the awareness would be the key, because many people are not even aware that these kind of treatments are available in India. Even at a high cost or exorbitant cost, they will be able to, take down the treatment. Most of the people accept it as a situation and just go for it, live with it. So, if the awareness can be created, it will be helping a lot. And again, I would like to reiterate that for the long and sustainable funding, the one-time funding will not help. We'll have to make a pool of the funding. And it is being practiced in the international market very effectively. Thank you.
Thank you so much. Dr. Anu.
I think all the panelists have also agreed for one point. The key word is sustainability. So if you are able to create a movement in India, let's say not only in India, other countries also, whereby we create a fund of funds, as Mrs. Sonal has just said rightly, whereby we are able to motivate not only corporates, plus donors, any kind of donors who would like to pull in the funds. Because what happens, once we can treat a disease, whether it's a daily disease or it's a normal disease, a disease is a disease and treatment is available. Need to fund the treatment of disease even beyond 1 year, 2 years, 3 years, even for lifelong. So let us work hard together with all business houses, with general public, with academia, with industry, that we create this fund of funds. And I will say one of the corporate, let's say we are already having IFC, led by Mrs. Sonal right now with us. Can we create a movement of this sort of this thing right after this session? So we create all strategies to create this kind of sustainable long-term fund of funds.
Thank you so much, Yadav ji. Yadav ji has been providing support पिछले 2 decades से. Final message, Yadav ji.
मेरा मानना यह है कि होलिस्टिक अप्रोच होना चाहिए और गवर्नमेंट सोर्सेज से और नॉन गवर्नमेंटल सोर्सेज से जो जेनरिक डिजीज वाले जो बच्चे हैं या पेशेंट हैं उनको लिबरल होके फंडिंग प्रोवाइड करने में एक्सक्लूसिवनेस नहीं होना चाहिए, मतलब सब सोर्सेज से फंड मोबिलाइज हो और पेशेंट्स को जो है इजीली जो है अवेलेबल हो और सस्टेनेबल वे में लंबे टाइम तक उनको फंड मिलता रहे और उसमें पॉलिसी और टेक्निकलिटी हर्डल्स नहीं होना चाहिए, मतलब कम से कम जो है टेक्निकलिटी हर्डल्स होना चाहिए और सारे पेशेंट्स को इक्वली ट्रीट करना चाहिए। अगर कोई इलिटरेट पेशेंट है, अगर उसके पास जो है ना फंड को चैनलाइज और मोबिलाइज करने के लिए अवेयरनेस नहीं है, तो जितने भी कॉर्पोरेट सेक्टर्स में काम करने वाले हैं, चाहे जितने भी स्टेक होल्डर्स हैं, उनके लेवल पे जाके उनके फीलिंग को समझ के उनको फंड को मोबिलाइज करने में कितना हेल्प कर सकते हैं वो ज्यादा मैटर करता है।
Thank you so much. So I think we understand कि it's a long journey. Parents को समझना है, हमें जल्दी diagnosis करना है. We have to have a holistic management, multidisciplinary management, standard of care, and then reach out for new drugs. And we have to avail of the humanitarian access programs and also the various schemes by the government and possibly some other, support, so that we have a sustainable financial options available. And that is important. And I think we can have we'll be creating a document of all these webinars and take all your inputs. Thank you very much for all of you to have joined. And thank you so much, Alessandro. Thank you, Sonal. Thank you, sir.
Thank you.
That's really very.
Thank you.
Thank you, ma'am. Thank you.
Thanks. And we will now move on to the last session of this series on parental counseling and coping strategies. And for that, I will request Dr. Kakuli to introduce our panelists.
Thank you, Dr. Shefali. Thank you, Mr. Neeraj. Thank you, Dr. Anup Daga, for joining here in the studio and for sharing your opinion related to the finance, which is really a very big problem and a necessity for the SMA and DMD patients. Today, we are starting with the second panel. We had with us Mr. Yadav also, who is the social worker. So today we are in the last session of our webinars, that is the parental counseling coping strategies. So we have with us Professor Manju Mehta. Professor Manju Mehta is a clinical psychologist, was a clinical psychologist in Department of Psychiatry and head of Child and Adolescent Psychiatry Division at AIIMS, New Delhi. She underwent training at NIMHANS, Bangalore. She has been trained in medical education technology and rational emotive behavior therapy from USA. She was in charge of undergraduate psychiatry teaching at AIIMS from 1984 to 2010. She has been involved in regular training programs in stress management within and outside the institute. She has been imparting training to members of judiciary on a regular basis and has been conducting the psychological assessment of Indian expedition members to Antarctica. She is credited with starting her regular PhD program in 2000 and has more than 18 PhD students at one point of time. She is recipient of prestigious Dr. M.V. Govind Swamy Memorial Gold Medal and many more awards. She also has many publications to her credit. She has been president of 3 associations: Indian Association of Child and Adolescent Mental Health of India. Welcome, Professor Manju Mehta. We have with us Dr. Madhulika Kabra. Dr. Madhulika Kabra, she has joined us in our prior sessions also. Thank you, ma'am, for coming here again. Is a professor in Department of Pediatrics, AIIMS, and is Chief of Genetics Division. She has been promoting the PhD in the department, and at one point of time, she had the maximum PhDs in her division. She has more than 360 publications and has many awards to her credits. We have with us Dr. Gagan Hans from AIIMS. He is an Associate Professor Psychiatry. He has many awards. He has been an invited co-editor, special theme issue on student wellness of Indian Journal of Social Psychiatry. Young Psychiatry Track Award he received in 2016. He has been awarded many other travel fellowship and other prestigious awards. He has been member secretary of Student Wellness Activities Committee at AIIMS. His main interest involves common mental disorders, biological psychiatry, community psychiatry. Welcome, sir. We have with us Dr. Renu Sutar, who is the Associate Professor, Pediatric Neurology Unit, Department of Pediatrics at Advanced Pediatrics Center, PGIMER, Chandigarh. She is DM Pediatric Neurology from PGIMER. She has more than 125 international and national publications and chapters. She is recipient of RCPCH Visiting Fellowship from Great Ormond Street Hospital, London, UK. Her areas of interest are CNS infection, pediatric stroke, pediatric neuromuscular disorders. We also have with us Dr. Vineet Jason. Dr. Vineet Jason is DM from CMC Ludhiana, where he is currently working as an associate professor in Department of Neurology with several original publications and chapters. He has special interest in neuromuscular diseases affecting both adults and children. Recently, they have initiated the Neuromuscular Center of Excellence to provide priority care for these patients. The center has put together a multidisciplinary team across several disciplines, including rehabilitation, cardiology, pediatrics, endocrine, orthopedics. They aim to provide holistic care to individuals and families suffering with limiting illness in hospital, home, and community. We have with us Dr. Shefali Gulati, who is facilitating the whole program. The whole webinar was conceptualized under her leadership. Dr. Shefali Gulati did her MBBS and is a gold medalist holder from AIIMS itself. She has received FRCPCH from UK, FAMS, FIAP, and FIMSA. She has started first DM Pediatric Neurology program in South Asia in 2004. She is heading the DM program since April 2008. She has contributed towards establishing this DM program in 5 more institutes, fellowships in pediatric neurology across the country and SAARC countries, and now Doctorate National Board also. She has more than 25 years of post-MD teaching work experience. She has developed pediatric neurology in India as a specialty, received many national and international awards for her efforts in this field. She has developed this specialty in academics, clinical care, patient education, awareness, research, advocacy, and public health domains. She has envisioned conceptualized and is faculty in charge of Center of Excellence and Advanced Research for Childhood Neurodevelopmental Disorder, which is providing the high quality, affordable care for all sections of society, performing high-end diagnostic and therapeutic research and acting as a education and a training hub. We have many national helpline which are and teleconsultation services which are provided free for all the patients, and we have loaded many mobile applications in our website. She has more than 375 publications and many awards to her laurel. So I give the mic to Dr. Shefali to facilitate this last session of our webinars. Thank you, ma'am.
Thank you. Thank you, Dr. Kakali. Dr. Kakali is a very senior scientist with us, and Dr. Gautam, who is on the left side, is also a scientist who is an alumnus of this place. And we've already gone through the whole series of webinars from how to diagnose to coming thus far. And Abhi, lastly, we had financial, how to have sustainable financial solutions. But I felt the most important thing was, parental counseling and coping strategies. There is going to be a burnt out, because before there is going to burn out, why should we wait for that? Why can't we empower our parents from the beginning to have their realistic goals and try to explain to them, so that, we have to look at the psychosocial mental health from the beginning. And, because in DMD, NSMA and all other neuromuscular diseases, most of them are progressive. So see, if a newborn is born, you're giving a lot of support to the child. Child grows up, your need of support reduces. But in these conditions, the need of support to the child is going to increase by the years. And the parents are advancing in their ages. So physically also it becomes challenging, emotionally also challenging. So it is very important to have a proper family counseling, besides the genetic counseling aspect, the whole counseling about the whole lifespan and everything and how exactly to go. So I feel we have to have in our multidisciplinary team, which we've been talking about, various teams, we have to have, although pediatric neurologists are the main people who are doing it, and they have to understand that they have to involve the other people, besides looking at cardiology, respiratory, bone health, and all the other things which we have been talking about. But we have to keep in mind that psychologist's role and in a preventive wellness thing, a psychiatrist role has to be kept in mind. And one thing I want to add, which we have discussed in the second webinar, I think that around 23% of these patients with DMD may have hyperactivity, 40% may have anxiety, and 50% may feel low. So, you understand that if they are cognitively relatively preserved, most of them are cognitively preserved. So they're going to the school, they feel inadequate, See, suppose the day we have हमारे को भी sprain हो जाता है, and you have to have some cast या कुछ, and we are not able to walk properly, सीढ़ी से नहीं जा सकते, lift में जा रहे हैं, we feel incapacitated, and that's brief. This one is long term. So I think it's very important. So I will start off. Dr. Manju Mehta, ma'am.
I am here.
Ma'am, yeah, ma'am. I saw. Ma'am, should we start sharing your screen, ma'am? Thank you so much, ma'am. Besides the formal introduction, I have been in AIIMS 34 years, and all along you have been teaching me, and we share a common birthday. And that is, so we have a close association all these years. Thank you so much for joining. Although you superannuated, but I think it's your mark on this, and we need your support and guidance. So, because ma'am, these areas are not covered, I think, and we got this financial advocacy grant for rare diseases, in which we are talking of financial sustainability, but parent ki to sustainability hogi na properly. So I think I felt that this was the most important topic to end it. It was my thought of view. Start,
ma'am. You want us to share, or you'll share at your end, ma'am?
Who will share?
Okay, ma'am.
Okay. I'm thankful to Dr. Shefali for inviting me for this lecture, because she actually has selected a very good topic, because medicines are one side. I was listening to the previous parents also. The expectations are very high. They always want that the progress should be too much. Okay. So there are lots of concerns with the parents who who have children who have got a rare disorders, they may be blaming themselves for having a child who has got this disorder. They may be blaming their genes. They may have guilt. They may, many times they are not interacting with other people. They have a social withdrawal because they always think that these problems are my, what will other people say, that they have this type of child, so they don't go out. And lots of them experience anxiety because anything happens to the child. It may be a normal thing, but they always think about the bad things. So they are always thinking about the negative thing. They may be having lots of stress because of financial problems, because of rearing up this child, and also because of problems in this child. They may be having trauma because this child is actually, they may feel that they have given birth to such a child, so the trauma will be there. So sometimes the fear are there because they also feel that all these problems are because of us. Fear is, if anything happened to the child, they are very into phobia that nothing will happen. Okay, so what is parent counseling? And family counseling is a type of service which avoids, it is a type of service which provides them knowledge about the disease and what to expect from the child. And also they give support to the child and without any bias or judgment. So this is not only necessary, but I would say it complements the treatment, because many parents, their expectations are very high. They think that the doctor will do a magic. So parent counseling is telling them that it won't be a magic, but it will be a gradual progress in your child. And lots of their problems are solved. Okay, next slide. So many times there are marital problems, divorce and separation, because mother is always blamed that you have given a birth to this child. They may be having financial problems. They may also think that bringing up this child, they may require some help in the home. They may also financial help for medicines and visiting hospital. They may be worried about the development and growth of the child. They may, sometimes the child may become too aggressive and he may also have a mental health problem. For example, behavioral problems are there. The parents also, caretaker has got many problems. So they may have problems because they are taking care of this child. They may always be having uncertainty of the future, that what will happen to this child. There could be a tension at house, and it could also be a sibling relationship, that some brothers and sisters may feel that they are not given so much of importance as this child is getting. They don't understand that this child needs more attention. So sibling relationship sometimes is disturbed because more attention is given to this child. Okay. And why should we give counseling? Because by counseling, the doctor helps them to have less anxiety and less guilt, and they will be having more confidence in themselves, because once there is anxiety and guilt is less, they will have confidence and they will accept the child for what he is. There will be more harmony and better relationship between parents and siblings. So there could be a stress relief also. There could be a trauma resolution and ability to set boundaries. I have seen lots of parents, they laugh off and they encourage the child for wrong things. They are not able to set boundaries. They are not able to give discipline to the child. So setting boundaries means disciplining the child. You will deal this and not do. And emotional balance is also very important. In which situation they must feel cool and comfortable, and in which situation they should be concerned about the child. It also gives lots of increased assertiveness in the parents, especially the mother, because lots of time I see that the mother is at home and she is always watching the child. So she always blames herself. So greater assertiveness is very important. Next. Next. Yeah. Next is there are lots of behavioral problems because either the child is overprotective, he is not given the chance to do things for himself. So he is overprotective for everything that he is doing. Or he may be rejected that he is a child who has got so many problems and they may not accept him for what he is. And there could be a disciplining problem, and the child may show all this by having lots of aggression, or he may be attention seeking, or he may start having lots of times because of illness, he may take advantage of his illness and do attention seeking. There may be school problems also. For example, there could be academic problems or adjustment problems. In the school, this child is also going to the school. So in the school, he may not adjust very well because he has got problems. Other children may bully him and make fun of him. And academically, there could be lots of problems. He may be not able to focus, or there could be comorbid positions. Shifali was saying that lots of children have hyperactivity. So academics may suffer because of hyperactivity, because of SLD, because of not focusing on the child, not showing the interest, and not having motivation to study. Next. So the parents always try some methods to cope up with the problem. So it could be emotional focused or problem focused. They may be sometimes ignoring or distorting reality. They may be activities that they may do to calm their body. They may be always doing some cognitive focused activities. For example, positive thinking that the child will one day become all right. They may distract themselves when they get very anxious. They may get into fantasy. So lots of problems are there, but the problem focused is best. Okay, next. Next. Okay, the problems focus means that you have to find the solution. I have seen lots of parents, they are the best judge and they can find solutions for the problem. For example, if the child is having atrophy of the muscles, SMA or DMA, so they may find the solution that how he can support himself, how he can support his posture, how he may be support. So you may talk to parents of the similar groups. There are groups or associations of the parents who have children with the similar problems. So if you talk to them, you get not only support, but you also learn number of ways that how they cope up with such problems. And don't get upset with the remarks of other people. I have seen parents, sometimes they are very innovative and they can do lots of innovative things to give support to the children. They can read stories of other people. They can be motivated. For example, that they should not give up hope. They should be hopeful. That is very important. By hope, you can do lots of things for your child. Next. So, lots of parents, they get into emotional focused coping. That means that they get into panic if there is a small problem. They are very fearful and they get into panic. They may start shouting at each other or crying. For example, if the child has got a mild fever, they may start crying. They may think of negative consequences only. They may use the wrong methods. I know of a father who never was at home, even on his holidays, because he didn't want to see the child. So he was sitting in the park and doing nothing, but he wanted to be away from the child. There could be a wrong method that they may indulge in drinking or showing aggression on other people because they don't want that the others should know that what is happening to them. This is their way of coping, but this is a wrong coping. Okay, next. Here are some tips for the parents that treat your child as a normal child. That means you have to use discipline for him and use reward and punishment. For example, if he is doing a wrong thing, then always tell him that this is wrong. You should, if he says that I will kill everybody, there is no God. So you have to tell him that this is not the way, and you have to reward him and you have to encourage him for using or doing lots of right things. Accept your child, because if he is having some problem, do accept him for what he is. Don't compare him with others. Accept him for what he is. Try to make him independent. Find methods to make him independent. Have faith in God and yourself and your efforts. Definitely, your efforts will help him a lot to give support, to deal with the life and to accept his problem. Thank you very much. Thank you.
Introductory, approach to the whole session. Thanks a lot. Please stay on. We'll be requesting you to add on. आप slides दिखाएंगे question वाली. So we come to the first panel question. Dr. Gautam, please, can you read the question?
What is the necessity of parental counseling in rare diseases like SMA and DMD?
Dr. Renu, would you like to start off the panel? Dr. Renu, slide minimize kar. Renu?
Yes, ma'am.
Yeah.
Thank you, ma'am, for inviting me in this panel. And I think it's a very, very important topic you have chosen for discussion today. So why should we have families with DMD and SMA involved in counseling? I think first and foremost is the parents has the right to know what the child is actually having, what is the problem he's facing, what he's expected to do in the life. They should also be having idea of that, that what they are really expecting from the child. Second, because it's a chronic disease and they have a life of next 20 years, or there is a life of around 30-40 years with some disability. So these children needs considerable support. So family and the child and the physician should be the same page, that these are the really this child is able to perform, and these are the expectations we should have, and these are the area where the patient requires support. So counseling is very important to understand the family, what is the natural history, what kind of expectations do they have from the child as well as from the treating physician. Sometimes the expectations can be like undue, like they may be expecting their child would become all right. So that's why it's important to give them an overview of the disease, that this is how the natural history, how the disease is going to progress, and what is these good point, or what are the positive points of your child, and what is the limitation of the child you have in future. Another point is that because it is a shared care for the life, so we should all be on the same page that now these complications are going to happen to this child during his journey or during the natural history of disease. So we are tackling these issues in subsequently over the years. And another important point, they should understand the implication of the disease. One member being affected in the family has an implication for the whole family. Maybe it's genetic, like the recurrence risk in the family. They may be asked for like extended family screening or carrier screening. So they should understand that what is the implication of these questions, which the physicians or physicians is trying to explain them. So that's why it's very important to these children who has a chronic disease, who are disabled and has a long life in front of us. So that's why the physician should counsel the parents about, parents as well as child. Child should also be part of the counseling team. They should also know that how the disease is going to progress, what are the complications they are expecting, what we all together can do for the management of these complications. So I think several stages this counseling is required. It's not always the like when you counsel when the patient present in the first go. You should not like counseling full everything, because they may be having this knowledge and hearing from everybody that nothing can be done. They are all totally dejected. So our counseling should not be like in one go only. So you take the parent along with this journey, keep on giving them information step by step, and giving them hope also is very important. So I think counseling is important for them to understand what is the natural course of the disease, what all they can be done together with the physician, the child. They all should cooperate and should be in the same page. So that's why I think it's important to have specific counseling sessions for children with DMD and SMA, because we have years together to work with these child. I think that's my take on how do we counsel, or what is the necessity of counseling or preparing the patients and families for this kind of a chronic disease.
Thank you, Renu. Dr. Vineet, you want to add?
Yeah, I totally agree with what Dr. Renu said, as well as thank you, Dr. Manju, for that excellent presentation. Counseling is the bedrock of managing these patients who come to us. And it begins right from the start, the first day that these patients come in, and how you handle the parents, what do you speak to them, how much to disclose to them. All of that depends at each stage and each visit. You have to expand on it slowly. I think that is very important. And of course, without explaining what the parents need to expect from children, it will not be fair. We need to.
It will not be fair. उसके आगे नहीं सुनाएगा.
Not to tell them the whole truth about the disease. But like Dr. Renu said, we need over a period of time. Yeah.
Yeah, but this is a dilemma. I personally do not like to tell a child that he's going to be non-ambulatory in the initial part. Renu, I mean, I may differ. I've been looking after them for a decade now, and I personally feel that makes them a bit low. But very rightly, I mean, I agree with Renu. Ultimately, we have to say, and like Dr. Vineet, we tell them slowly when the disease is progressing about that thing, and that they should not feel inadequate, because there are other conditions like by counseling them and all. Absolutely, but she was right. But what I mean is, it has to be staged out, like you're saying. Initially, when they're coming first time, you're counseling, that time you will not do. Like we went through, we had a session on breaking the bad news. So that also we discussed last week, that it comes staggered in stages. You can't just pull it on to the family and the first time that it's, all is like that. But yeah, that is there. But I avoid telling in the initial part when the child is really ambulatory. Once start having some progression, then only I will tell. Otherwise, parents have told before. So
that's why, ma'am, they all have this negative news with them. So I think it is a stage process, and we take them along with the parents and child throughout these stages. So not in the first go, but definitely as the disease progress and you anticipate these complications, there has to be like continuous kind of counseling session should be provided to them.
Yeah, thank you. Thank you. Can we have the next question, please?
So the next question is, who all can take part in the counseling process, and what is the role of psychologists in coping strategies for families when their child is diagnosed with such rare neuromuscular disease?
I think I'll edit this question. We have heard the psychologist. I want Dr. Gagan. What is the psychiatrist's role, and how how we should be talking about it in consonance with the psychologist? Ma'am ne pura detail mein bataya, but I think it's I personally feel a psychiatrist's role should come even in preventive mental health issues than to have a burnout. And Dr. Gagan Hans than to have a burnt out and then having depression in the mother and father and all, and then do. I mean, what is your take? I don't know whether there's anything called a preventive psychiatry, but I just use the term. I'm sorry. I felt that we should be working in consonance to prevent the mental health challenges, because stress to hai. All yours.
So, ma'am, regarding the who all can participate in the counseling process, so there are no hard and fast rules regarding who should be the participants and who should not be the participants, depending on their understanding of the illness and what the family is going through. You can involve as many members of the family as much possible. Siblings also, if they have a reasonable understanding of what all is going on. I would like to add something here that regarding the disclosure to the child. So child is anyhow going to find out through the procedures and what all is happening through hospital visits over a period of time. So children are very smart actually when it comes to, they actually are going to guess it. And I totally agree with you that maybe slow disclosure over a period of time helps rather than finding out themselves, because there have been studies on this that what actually happens once they find out themselves and what actually happens once you disclose it slowly over a period of time, although not in child, but in adults. Regarding the role of psychiatrists, actually, the role of psychiatrists in the initial phase will be very limited. This is what I have to say, that initially the primary role will be that of counselor, because if you see the Western countries or the Western setup, so they have a counselor whose role starts right from the time you have to disclose the diagnosis. And there are no guidelines regarding this, but what is followed out throughout the world is that once the child is being evaluated, or the counselor will usually have a session with the parents, and counseling should have those set of skills where he recognizes that what is the psychic reserve of the parents, like how much is their understanding, what is their educational level, or what kind of socioeconomic background are they coming from. So what is going to be the impact on the illness? So the person who is providing the counseling in first go, so first session is regarding his kind of evaluation that what all is going to happen, a reasonable expectation of things which are going to come, how are they going to take it, and how they are going to react to the diagnosis. So initial session is usually of this nature, followed by disclosure in the subsequent sessions, depending on what his assessment is during the initial phase. So that means that the role of a trained counselor, counseling can be done by anybody as far as the diagnosis, the definition of counseling goes. So anybody can do the counseling. But here comes in that what is the importance of having a person who is adequately trained to make out or to have an evaluation of the person who he or she is counseling regarding all these things. So if we have a reasonably good evaluation in first go, so that means that the subsequent sessions where right from the time where there is a disclosure of the diagnosis to the point where he or she or the counselor helps the parents adjust to the new norm, because this is going to be a life-changing event for them. So this is what the initial role. So definition, counselor can be anybody. Counselor can be a trained professional, can be a psychologist, can be a psychiatrist also in first go. But it is really very important that whosoever is counseling, he should be able to make a reasonable assessment of the family, and then because there is no standardized way, so you have to tailor made your approach in each and every patient, in each and every family. So you have to tailor made the approach depending on what the responses are coming up from the front. So what is your assessment of the family, child, and their total my view of environment from which they are coming from? So once that assessment is right, so the transition is going to be smooth. Thank you.
So I think next we have already basically talked about prerequisites. We can go next. The protocols, we have also talked about the protocols, but one thing is there, I have this open to all, whether any, we can involve the parent support groups and NGOs in their counseling. You're right, we tell up to patient from the beginning. My only issue is to talking about the prognosis, but you're very right, and I'll tell you what happened. I did not try to tell about the prognosis in one of the patients, but then the father told me he's already read on the internet. So they're smart, they have already read the prognosis on the internet, although I did not tell them. So that is what is there. So it is important to we understand, and then we can ask parents if they have got any support from the parent support group, during their initial part. So anybody wants to say that, Renu, we need Manju ma'am, Gagan, anybody saying? Anybody saying? Anybody?
Yeah, I think.
Yeah.
This is Vineet here.
Yeah,
so the support group has been a big help. I think parents, there are good support groups still existing, and after they meet me or they leave the OPD, we put them in touch with other parents who have similar problems. And the conversation they have with the parents is much more intimate, and many things are discussed. With the doctors, there's always an anxiety when they sit in the clinic, and despite you trying to make them comfortable, they don't open up much. But when they talk to the family sitting outside and they hear about it, and then they see what has been done for them, they understand the disease process also much better. So I do think parent support groups are an essential part, especially in rare diseases like Duchenne's and SMA.
Can we, Satish ji, do you want to, anything you want to add? And we have Kitanjali from FSMA. You are from you're supporting SMA patients. You want to add something? Yeah. Thanks for joining. You've been joining off and on in many sessions. Thank you so much. Yeah. Anything? Anything you can provide support.
Thank you, Dr. Shefali, for this wonderful panel. And mental health
is it?
Can you hear me?
We can hear you. Can you share the video, ma'am? Is it okay with you?
I'm sorry, I have a very poor signal. If I get into video, you might not be able to hear me.
Okay, ma'am. You continue, ma'am. You continue.
Yeah. So I was saying that, thank you so much for this wonderful panel, and mental health and counseling is such an important aspect of patient journey throughout. So I would say that, right from genetic counseling also involves a lot of mental counseling, because when the mother is, has to go through so many tests, and they want to know whether the child is okay or not okay, and then the specific disease is discovered, at that point of time there is a lot of hand holding that is needed. And if there is professional counseling provided in some form, that will really help people in a very long way. Yes, patient advocacy groups help, and they do support in a very big way, because they've been through their journey themselves, and there's a lot of learning that they have and they bring to the table. But it is also very overwhelming for every new parent to understand it or to know about it. And see, every patient journey is also very different. they're like, even in SMA, a type 1 patient goes through a very different journey than a type 2 or a type 3 or a type 4 later. And even in type 2, you'll be having kids who could, do so much more than another kid or so much lesser. And every parent has, and the patient have gone through very different circumstances. But I would say that counseling at every aspect is important, because all the challenges that they go through in terms of, developing a child in the household, in the society, inclusiveness in school, in education, employment later on, and even in a lot of the doctors said that within the family, between husband and wife, the dilemma that they go through, or the challenges they go through while raising a child, that's a lot. And I think that proper counseling is much needed. And yes, patient advocacy groups definitely help. The stories help. It gives an opportunity to other people to learn from them. So I think I mentioned in one of the earlier sessions also, I'll say it again. We had we had run a campaign called 30 Stories, 30 Days during one of, last year's SMA month. And what happened in that was that people wrote, for the first time, they felt that they have been heard. And we presented it very beautifully. You can go on FSMA site or an Instagram account and read those stories. But people actually spoke about their challenges and their journey, from the discovery to where they are today and what all they had to go through. And they're so proud of their kids or themselves by being through those difficult circumstances. And those are very beautiful, inspiring stories for other parents, for normal people, for everyone.
Yeah, Gitanjali, thanks. Thank you so much. We've had 3 sessions for parent support groups. Now I want my experts there to say thank you so much for the support that
thank you, doctors. You're doing a wonderful job.
No, thank you that you are going to be there for counseling wala thing for them, that is there. And I have some questions there for because you know what, we were running late because of previous one and we have only around 19 minutes left. So that's why I'm saying there's a question. Good morning. Thank you for it's anonymous attendee. Good morning. Thank you for the wonderful session. How do young DMD adults and parents cope with mental health issues like anxiety, OCD, social isolation, especially due to lack of transport facilities and people's mindset? Who do not know how to talk or engage their kids? Can trained psychologists be identified and available for these rare diseases statewise? And many young adults also suffer from schizophrenia, which makes it doubly difficult to handle 2 progressive conditions. Even CBT, cognitive behavioral therapy, does not help, nor the medications. Dr. Gagan and then Dr. Manju Mehta and then Vineet and Rini.
So I think regarding this question, what is meaning to add is that what if there is a comorbid condition which will definitely have an impact on the overall prognosis, but it's not like that. These patients, I would not like the conclusion has been drawn in the question that neither CBT nor the medications will help. It's not like that. So definitely we can try out some medications on some basis where we can definitely help these patients who have a comorbid psychiatric condition. And it's not just about giving medications. So you have to look at the overall well-being of the person who is suffering from the condition. So we can identify some other factors which may be contributing to the overall morbidity. And prevention of anxiety, OCD, social isolation, per se, the most important thing is to be sensitive to pick up the early signs if somebody is having these conditions. It's not just once these conditions develop that you seek out treatment for these conditions. So what we need is that the parents should be adequately sensitive to pick up the early warning signs, both in themselves as well as the children which they are suffering from. And what it requires is that it should be, it's an overall condition, the state of affairs of the mental illnesses in our country, that people feel a kind of stigma attached to it. That it is somehow thought to of at a sign of weakness if you are seeking help because of your mental state. So the most important thing is that the social support, which comes from the immediate family and friends, immediate family, friends, as well as the support groups, which we were just talking about. And we should encourage these parents and in these support groups that they should be more forthcoming from what they are feeling, right? So it's not okay. We should be telling them that they should be true to themselves, in the sense that if you are feeling low or if you are wanting help, you should seek out, reach out to people who are in your surroundings. So it's not that acting tough is a thing, in the sense that you have to act tough, you have to rise up to the occasion. It's okay to seek help. It's okay to feel that, yes, I'm feeling low, I need some sort of help. And maybe if the condition is not that serious, talking to the family and friends in the immediate vicinity, ventilating your feelings will help you a lot. And if even that is not helping, and there are subtle warning signs that maybe on a day the things are downhill from the past couple of weeks, then definitely you should go out and seek help from a trained mental health professional without feeling any need for stigma. And on the preventive aspect of it, I would like to say that we need to propagate this thing among these groups, among the parents, that what are the warning signs for common psychiatric conditions like anxiety and depression, and how to identify and when to seek help. That is the key to prevention.
Thank you. Manjumata ma'am, you want to add?
Yeah, I think he is very right that CBT cannot help. It is more of supportive therapy which can help, and caregivers need support. So Dr. Renu also said we have to give support and we have to hold hands. So once support is given, everything will be, they will be able to handle the situation very well. And finding a clinical psychologist is not a problem, because these days there are many psychologists both in government jobs and in private practice. So you can always take help of a trained clinical psychologist.
Yeah. And thank you, ma'am. Dr. Renu, Dr. Vineet, actually the point, they are not reaching, the parents and children are not reaching the psychologists and psychiatrists. We are followed up by us in neuromuscular disorder clinics. We have to have high index of suspicion and our assessment. So how do you think, we recommend that we look after the families and children in the preventive mode?
Ma'am, I'll take here. I think when we see lots of children with neuromuscular disorder along with their parents in the clinic, among those few, we can identify the family who are like really in stress or they want to tell us something. So during our routine sessions also, so we can identify symptoms of depression, anxiety in the parent itself when they are like reporting to us. And what we see that children with DMD per se can have issues with the autism and ADHD along with them. So we do not see much adults or adults with these schizophrenia and all, but we do see children with autism and ADHD and DMD who needs the additional psychological evaluation, because sometimes to get the family into rehab is difficult with these children. So these children do need evaluation with psychology, scoring. Sometimes they do need medications to control the behaviors. But I say that as we are the primary one who are seeking these, we are treating these families, and we can identify symptoms of stress and anxiety, depression in these families when we are speaking to them or during our counseling sessions. So we can definitely guide them to seek care as early as possible. And regarding adults, what we have understood that support group do really help these patients who are finding difficulty in managing their day-to-day activities, transports and all. So sharing their problems with the similarly affected patients, parent support group definitely make their life better. Because in isolation, they feel that they are really dejected or they're isolated, but there are the other persons or the people who are going through the same journey will definitely give them how to handle and how to cope with these situations. Thank you.
Thank you so much, Renu. Vineet, you want to add something?
So as part of the multidisciplinary team, what we do here is that we make sure that the patients see the psychologist, because it's very hard in a short session or, as a neurologist, when you're seeing the family, to be able to address so many multiple issues. We don't have the time for it. And also at some level, we are not trained to be able to address many of these mental issues. So having a psychologist has been a big help. That is one. The other thing is also regarding the question. Each part of the question is, I think, has a different answer to it, in the sense that anxiety, OCD can very well be, to a certain extent, managed with medicines. But the social isolation part, there is no other answer but support and society and community coming around these families to help them. I know that's easier said than done, but it is, we have to work towards that. And the transport facilities, all of these are such an important aspect of mental trauma that these children and parents go through, because people don't know, like the questionnaire has said, how to talk to them, how to engage with these kids. That is why inclusion in society is a very important part of our treatment and what we're trying to look at. But I feel each of them have got a little different solution. Regarding schizophrenia, I think that needs to be handled by a very trained psychiatrist. And there is no other way to go about that. Yeah, thank you.
I think it's important that, we also talk, and, we should have a pediatric neurology nurse, we should have a social worker and a psychologist. But then, point is we have to understand, and probably we should have group counseling sessions as well. And the parent support groups are going to help. Even Geetanjali has sort from FSMA. So basically, and any good or bad coping mechanisms? Can you have some negative coping mechanisms which you don't want to have? Dr. Manju Mehta, Dr. Gagan?
Yeah, I mentioned that because some people are drinking or getting too abusive. So they are abusive towards people around them. They are also fighting. So these are negative coping strategies. You have to find a solution. You have to be innovative. That is a good solution. You have to accept your child and use reward and punishment.
Absolutely, ma'am. Actually, last OPD, there was a mother who was going on slapping her daughter, and then the father was abusing the mother. So I just went into said, I said, it's not the child. The mother is slapping because she's frustrated and she's exhausted, So it was just a burnout situation. That's why, and the father has nobody, but he'll just scold the mother. So there is so much of domestic violence and abuse, and even towards the child. And
there is so much of blame.
Divorce, as you mentioned, divorce, and they just leave the child and go. That, as you mentioned in your slides also. So in that situation, thank you. Dr. Gagan, you want to add anything to what ma'am has said?
What I want to add is that it's a very fine balance which is already there in a family settings. So everybody, once this a disease comes along in the child, so it puts a lot of pressure on the family, especially the parents, and there are other concerns as well. So there are a lot of financial implications once the disease comes along. Yeah. It's not just the emotional component, it's the financial component, it's the time which they have to invest in the upbringing of the kid or the care of the kid. So they need a lot of support in this initial time. And the best way, I think, what the strength in the Indian settings is the family, which we often ignore and which we often don't recognize. As compared to the Western society, our strength is the family, the immediate family, our support structure. So this can be promoted to a great extent that maybe the support groups or the other parents, all these things take time, but what they can immediately reach out to for help, for financial help, or for emotional help, or even it won't be very strange to find out people whose brother or mother or grandfather of the child or the grandmother of the child shifts with them just to take care of the child. So you have to recognize this thing that family is a big strength which is present in such. Sadly, in metropolitan cities like New Delhi and other Mumbai, so the family structure is getting more nuclear as compared to the rural or semi-urban settings. So this we have to recognize, and we have to promote this thing, that seek help from your immediate family as much as possible. This will take care of a lot of problems, both in the short term as well as the.
Thank you. Another thing is grief counseling at the loss of the child who we've cared for. Like in SMA type 1 would be few months, but in DMD maybe 2 decades. So, like that grief counseling is a very important thing. In that, then they should be sent to psychologist or psychiatrist whatsoever, advice to us as
the pediatrician can do this.
Okay, only then any guidelines, ma'am?
Guidelines are many. Yeah. For example, if you listen to them and teach them what are the positive ways of helping, and you can always be into good memories of the child.
Yeah, ma'am, actually, that is what actually I want the message to go, because I think as pediatric neurologists, we are handling the patients for long. I think we have the responsibility to, we have a psychologist, yes, but it's difficult to send through a psychologist. We should have a high index of suspicion of what's going on in the family for providing support. Yeah, if we have, Vinny, that is right, absolutely right. We also have a team, but there's so much of turnover to get to send to everybody. But we should ideally have a pediatric neurology nurse, which we have, and a psychologist. We do have 3, but there's so much turnover that I think we should have. What you were saying is right, but if there's grief there, we have to counsel. And what ma'am said rightly, are listening to them, because those psychologists will be new for them, but we are old for them. So they have more confidence level with us. Anything else you want to add, Dr. Gagan, Dr. Renu, Vineet, for this? For this question of grief counseling. After that, I will request Dr. Geeta Jotwani, a very senior scientist in charge of heading so many areas on working on these novel therapies and all that, to say a few words, and then Kakuli would put on the poll questions meanwhile, and then I'll ask all the panelists, starting from Manju ma'am and Gagan and Renu and Vineet, to give their final comments. So you can just... Dr. Geeta?
Yeah, good afternoon, everyone. I'm sorry I could not join the complete session, but whatever I heard just a few minutes back from all the panelists, Shefali, I must congratulate you for organizing this beautiful series of webinars and involving so many experts on different disciplines, and the way you have the approach you had, the holistic approach to how to manage DMD and SMA patients and caregivers and everyone. So I really I realize that what everyone is saying is perfectly fine. But just to add a single point here, that time-to-time counseling of our caregiver is very important along with the patients. So that is very important. And I mean, whatever well-planned sessions you had, I missed out many important points here. But as far as ICMR point of view, I feel that we need to start a multidisciplinary approach and task force kind of activity for the MD, SMA, or many more such disorders where we need to work together to provide all the possible management of the patients and the caregivers suffering, whose child is suffering with DMD and SMA. And I just want to tell you that about these novel therapies, ICMR is coming up with big programs. We are also trying to make it like make in India kind of efforts to have affordable therapies for these conditions. And as there are some success in Western countries, so we are in dialogue with these entities, and so that they can come, and if they make it in India, because we have all resources in India, so we can make possibly afforded affordable therapies for these diseases. But as far as ICMR is concerned, the research and the management of these conditions, I think I'm in a dialogue with the scientist who is now looking after DMD in our division of non-communicable diseases. But at the same time, what I am looking at the multi-pronged approach, genomics, and of course the new generation therapeutics and all. I think we need to work together, come together, and think about how we should do research activities, management, and even education awareness. And I mean, I need to sit with you, Shefali, and maybe the panel members sometime. We can have a brainstorming and we can design a good program for this kind of activities. Thank you, Shefali.
Thank you, ma'am. And we'll be bringing out the report and all of this, and we'll take your guidance and think how to take it forward. And thank you so much for joining. Final comments from Dr. Manju Mehta, ma'am, and Dr. Hans.
I think the parents should take it as a challenge because they can take care of such a child. That is a challenge which no other parent can do. So take it as a challenge and reward yourself and for taking care of such a child. You can always praise yourself that you are doing so much for the child. And you must have faith in God and yourself. That is my advice to parents.
Thank you, ma'am. Dr. Gagan?
Yes, finally, I would like to conclude by saying that since we know that what kind of settings we are working in, where there is a very high patient load and resources are very limited. So the key thing is that to understand that not all parents will require a great deal of support. So the important point is to triage at the outset who all are the parents who require support. So this requires that the first session for triage, the person who is doing the first session, whether it's breaking the bad news or getting the initial assessment. So at that point of time, that person should be adequately trained to make this out that yes, who all are the families which require a great deal of support. So there's no standard way of coping with this, right? So there will be families who will cope up very well, and there will be families who will require a lot of support. So the key is triage, the first assessment through a trained person, so that the resources are adequately allocated to the people who need them the most. Thank you.
Dr. Renu?
I think if we are working in an ideal situation, a multidisciplinary team where we have a social worker, a nurse, and a psychologist who can talk to the family would be very, very well initiative. But since we are working in a resource limited setting and we have to deal with several of these families in one single clinic, so I think okay, sorry, it was muted. So I'll just say that
one single clinic tak sunai diya.
Yeah.
Clinic, we all are seeing so many patients.
Yeah, so we are seeing so many patients together. So, but I think we should be able to identify the families which really needs help. And being a primary caregiver, neurologists or pediatricians who are dealing with these families can identify and seek help. But I think the journey is long, and the family should be like along with you during all these complications and anticipated events which is going to happen during the lifetime of the child.
Thank you so much, Dr. Renu. Dr. Vineet.
Yeah, I think, for parents and even for us as clinicians, it's not easy. But like Dr. Manju said, and we are transformed, even us as we care for these families, care for their children, we are transformed into better people, into better human beings. It's an opportunity for us to understand suffering and to be there to care for them, which we would not have been had this not happened. I mean, that's just one thought. Thank you.
Thank you. Thank you. I will now request Dr. Abhishek to make some comments.
Yeah, thank you, ma'am. So I think everybody has spoken about everything that is important, but one just small message that the way we see all these patients like DMD or SMA when they come to our OPDs or clinics. So we should make this psychological aspect, this coping strategy aspect as a routine part of our, monitoring and looking after these children. So apart from their medical issues and the way we plan their investigation, we plan their treatment, even this should become an important part of their day-to-day follow-ups, day-to-day visits, that how the child is coping up, how the parents are coping up, and what, psychological and mental support they need. So that should become a routine part of their management and treatment protocol. So I think that would help them in a big way. And thank you.
Thank you. Prashant?
Thank you, ma'am. I'd like to thank the panelists for the type of discussion that was going on this topic, and I fully agree to whatever has been talked of. What I would want to say is that, yes, as a pediatrician, as a pediatric neurologist, the onus is right on us. So we should take this, that we are going to plan and take care of this child on a whole, and the treatment has to be family centered, not just on the child. And we should be the persons who should be caring for all these aspects of the child, so that holistic development, whatever is the maximum potential to which the child can go, we can all come together and let the child go into that direction. Thank you, ma'am.
Thank you. Thank you. Gautam, you want to make something?
All the points have been well discussed by the various panelists and all the members. So I think these patients need a holistic care, and both the government as well as private sectors can collaborate with each other to provide viable solutions to the problems these children face.
Dr. Kakuli?
Thank you, Dr. Shefali, all the panelists, all the participants. Yeah, it has been really very nice to touch upon all the aspects of DMD and SMA, starting from the clinical pathophysiology, starting from detection, diagnosis, screening, how to help, and definitely the biggest aspect, which was touched upon each and every webinar sessions, we had spoken about the finance. So with this, we are towards the end of the session. Over to you, Dr. Shefali.
Thank you. Sorry, I did have some hand raised. We actually have to wind up. Mr. Sunilji, if you can speak in one line, you can please say, because we have to close this. We had to hand over this at 12:30. So it's already, we are 6 minutes past it. If you want to have one word, one line, if you want to make any suggestion, and if you want to make any suggestion more to add in the collation, we can do that, sir. And Mr. Murali, you had made a lot of comments. We have made note of them, and we will be adding them in the document we'll be preparing, because it's all being recorded and live streamed. So all the comments would be there in the recorded version, and we will be adding all your comments, and we have well made note of it. Okay, so and I think nobody, he's lowered the hand. So I thank everybody and the participants who have been there from the beginning. So basically, it's just the beginning of a long journey, and it's together that we have to go. And together is not only the parents. Parents also, they have to understand it has to be their extended family, like Dr. Gagan was saying, that are our positivities. If we have, yes, and not only our blood relation. I feel I'm encouraging buddies, buddies in the sense, if you're having same problem, living similar places, we can share the burden, I may say, or the stress, I may say, or the challenges. Because, if you are living in a same area, we have developed that even for autism, the people are praying on the same, because they know how to take care of the child. Despite centers, we have discussed about it. But suppose if two parents, both of them are busy in something, they have to leave the child somewhere. So they can give it into another, if they don't have a family taking care, you can look after friends. Friends are those people in the same problem. So I think parental support to each other per se in parents is very important. And then as pediatric neurologists, we have to see holistically, and we have to work with geneticists to have an early diagnosis, and all the researchers which are there and all the funding agencies. We've had discussion with all the pharmas, financiers, economists. We have people from globally given us inputs. So abhi we have to think how we can work together to get newer therapies indigenously developed in India by research, because principles are same. Right? When you get antisense oligonucleotides, it's similar things, everything similar. So we have to understand that. And as we discussed in the morning, that humanitarian access and all are not the sustainable ones. How we can have sustainable financial outcomes could be there. Really, thank you very much. All of the All of the recorded versions are there live streamed in YouTube. We have a YouTube link. We will be putting them together with a QR code so that you can have it from the website, our website, and it will be in Global Genes website. We'll be preparing a document for the same, and I hope we all together can make a change in the lives of all the parents and the families. And together we have to go forward. Thank you very much. Jai Hind. Wind it up. Yeah. Thank you so much.
And definitely we hope that these webinars had been very beneficial, and we'll look forward for having more webinars for any neurological and neurodevelopmental disorders in future. Thank you.
Thank you so much.
Recording stop.